So good day to our clinical instructor, Mrs. Marie Sue F. Kuala. I am Mary Joy S. Folio, and I am your student nurse for today. So for today's return demonstration is I'm going to perform the administering of nasal instillation. So before doing the procedure, I'm going to dictate or state the types and the purpose of nasal instillation. So first is we have the decongestant. So this is for rhinitis and sinusitis, and for example is the saline drops. And for antimicrobial agents, for sinusitis, the maxillary, the ethmoid, and the frontal sinus may inflame and narrowed, so leading to inadequate drainage of nasal passages. So this leads the secretion to remain stagnant, and then which promotes infection. So what is the purpose of nasal instillation? So the purpose is to relieve the congestion of the nasal passages due to production of secretion. So that is for the types and purpose of nasal instillation. So now is we're going to do the first step of the procedure. So the first step is for nasal drops, we have to determine which nostril is affected by referring to our medical record. So this is my medical record. So now is I'm going to refer which sinus is affected. Okay. So the rationale behind this is that this affects the position of our client later on during the drug instillation. So it is very important to refer to our medical record. Okay. And the next step is to assess the client's history of hypertension, heart disease, diabetes mellitus, and for hyperthyroidism. So the rationale behind this is that these conditions are contraindicated with the use of decongestant medication because the medication stimulate the central nervous system. Then the side effects transcend to the hypertension, for the also the tachycardia, the palpitations, and headache. So these symptoms may occur. So gladly, the condition of our patient is the administering of nasal instillation is not contraindicated to our patient. So the patient didn't experience hypertension, the heart disease, wala siya diabetes mellitus, and also the hyperthyroidism. So we can proceed to our procedure. The next is to identify the patient. Okay, and we have to check the identification bracelet, and also we have to ask the client to state her name. Okay. Good morning, ma'am.
Good morning, nurse.
So ako na imong nurse karon, ma'am. Ako si Mary Joy S. Folio. So alayin kong state sa imong name, ma'am, and date of birth.
Akong pangalan, nurse Ivy Marie Griffon, and adlaw sa akong natawhan, November 11, 2001.
Okay, ma'am. So alayin ko kuan sa imong identification bracelet, ma'am. So patient name is Ivy Marie C. Griffon, and the date of birth is November 11, 2001. Okay. Thank you for that, ma'am. Okay, so the rationale behind this is to ensure that the right patient is receiving also the right medication. Then, next to that is using the pen light is we're going to inspect the condition of the nose and the sinus of our patient. And also, after that is we're going to palpate the sinus for tenderness. Okay. So, ma'am, ako sang i-palpate, ma'am. Ako sang i-inspect first, ma'am, ang imuhong nose. And also, ma'am, is after that is akong ipalpate ma'am imong sinuses. Okay? So, alayan ko. Ayan, ma'am. Okay? Okay. Thank you, ma'am. So, the nose of our patient is nagka-runny nose ang atong patient kay naka-experience siya sinusitis. And before that is, and after that, after inspecting is akong ipalpate ang sinus sa atong patient for tenderness. So first, before touching the patient is, I'm going to sanitize my hand. Okay. Okay, so to reduce the transfer of microorganisms. Okay. So, ma'am, ako ipalpate imong sinus, ma'am. Then, tell me, ma'am, if painful ba siya? Okay, ma'am?
Sakit, nurse.
How about this one, ma'am?
Sakit, nurse. Alam ko sa nurse kasi siya.
Okay. This one, ma'am.
Sakit, nurse.
Kana.
Sakit.
Okay. Thank you, ma'am. So, the patient state na painful ang iyahong different section for our sinusitis. Okay. Then, after inspecting the condition of the nose and the sinuses, is I'm going to assess the client's knowledge regarding the nasal installation and also for the technique for installation and also for the willingness of our patient to self-administer. So karon ma'am, kabalo ka unsa atong buhaton?
Sa akong nabalaan, nurse, na ako'y tambal para sa ako ang indong kasi sa akong sinusitis.
Okay, ma'am. So, nadiri atong medication, ma'am, as you can see. Kani siya, ma'am. Later is ako nang siyang i-administer nimo, ma'am. This is a nasal drop, ma'am. Then, since ako nang napalpate ang imong different section and katong imong giingon na painful siya, so kani siya nga medication na maka-help ni ma'am to ease the pain. And also, ma'am, later, akong i-position imong head sa different position nato, ma'am. Then also, alayon ng kukuan, ma'am, pa ng remember sa mga different positions sa atong head, atong the dosage na need or the number of drops need para kaya na nato ang risgo sa mas worse na case if na dili sakto ang paggamit nato sa medication. So, ready na ba ka, ma'am, sa atong procedure?
Yes, nurse.
Okay. Then, willing na ba ka, ma'am, na maka-cut on para maka-self-administer ka?
Oo, nurse.
Thank you for that, ma'am. Then, after assessing the client's knowledge, also we're going to explain to the client regarding the positioning and the use or regarding the positioning and so explain the procedure to the client regarding the position and the use of medications, and the rationale behind this is that to help the patient. Okay. So after assessing the client's knowledge about the medication installation, now is I'm going to explain the procedure to the client regarding the positioning and also the sensation to expect during this, such as the burning sensation and the stinging sensation of mucosa or the choking. So while we administering the medication and the tickles of the throat. So ma'am, so since na-assess na ko imong knowledge about sa atong medication and the positioning, karon ma'am, is ako siyang i-explain ang while mag-administer ko sa nasal drops, ma'am, is maka-feel jud ka na kuan ka ng burning sensation like kanang kuan, ma'am. Kanang maka-feel ka nga nag-init something sa sulod, ma'am, and administer sa medication is pati sa imong throat is kanang katul. So pero don't worry about this ma'am kay normal ra na siya while nag-administer, and later on mga pila ka minutes din mawala ra pud na, as well as sa imong nabati karon. Okay. So this helps the clients to anticipate about the experience of the procedure, and also para ma-reduce ang anxiety sa atong patient. So that's it. So after that is I'm going to wash my hands and arrange the supplies. So we have here the facial tissue, the medications, as well as the clean glove and the kidney basin as the waste container, and also the alcohol. So I'm going to wash my hands. So to also reduce the transfer of microorganisms, and also arranging the supplies saves times, and also this ensures the smooth flow of our procedure. Okay. Okay. Then next to that, after washing our hand, is I'm going to instruct the client to clear or blow her nose gently, unless if it is contraindicated. Okay. For example, the contraindication for this is that it the risk of intracranial pressure and nosebleed. So I have to explain that to the patient. Okay. So ma'am, karon ma'am is alayon kog sigma ma'am, pero hinay-hinaya ra ma'am. So ma'am, alayon kog clear sa atong nose ma'am, pero hinaya ra siya ma'am pag sigma ma'am. Okay. Clear ma'am.
So ni siya nurse kanang dua
Both nostrils. Okay, so dere ang kidney basin. Then since naka-blow ka sa imong kuan ma'am, is ako sanitize imong hand. Okay. Okay. And then next to it is now is we are ready to administer the nasal drops. Okay. So first is to assist the patient in supine position. This is to provides the access for our medicine administration. Okay, ma'am. So, pahigdaan tikaw dali, ma'am. So, i-assist lang tikaw, ma'am. Okay. So, comfortable na ka, ma'am.
World nurse.
Okay. The next to it is we're going to position the head properly. So, okay. Okay. So, for the first axis is we have the axis of posterior pharynx. So, we have to tilt the head backward. Okay. So, okay. The next to it is we're going to support the client's head, okay, with our non-dominant hand. So since I am right-handed, so I'm going to assist the head of our patient with my left hand, okay. Then now is we're going to place the instruct the client to breathe through mouth. So the breathing of the mouth reduces the chance of aspiration to to our nasal drops into the trachea, then down to lungs. So, ma'am, alayan ko kuan ma'am ang ginhawa. Okay, ma'am, alayan ko ginhawan gamit ang imong baba, ma'am. Kay since magbutang man ko sa imong nose, ma'am, og drops, so pwede na possibility nga matukan ka or something ana, ma'am. So, alayan na ko kuan, ma'am. Okay? The next to it is we're going to place a dropper 1 centimeter or 1/2 inch above the nares so that we can prevent contamination. Okay, so now I'm going to get my dropper. Okay. Okay, same. Okay. So, alayan ako tilt sa imong head, ma'am, backward, ma'am. Okay, so, pera.
Yes, ma'am.
So, ready na ka, ma'am. So, alayan ako ginhawa, ma'am, yung sa imong mouth. So, mag-start ka. Okay. Since 2 drops, you prescribe sa doctor. So, 1, 2. 1, 2. Okay. So, we're going to instruct the client to stay in supine position for 5 minutes. Okay. So, we're done for the first axis. Now, let's go to the second axis, which is the ethmoid and the sphenoid sinus. So for the ethmoid and the sphenoid sinus is we're going to tilt the head, head back of our patient, and we're going and okay, so for the ethmoid and the sphenoid sinus is we're going to tilt the head back over the edge of our bed and or place the pillow under the client's shoulder and tilt the head back. So now is I'm going to get our pillow first. Okay, so I'm going to place. So how about that, ma'am? Comfortable ka, ma'am? Okay. Okay, so same procedure. After that is I'm going to support the client's head using my non-dominant hand to avoid straining of the muscles neck. Okay. Okay. Then I'm going to still same. I'm going to instruct the client to breathe through mouth. Okay. Next is ako nang kuan, ma'am, ibutang, ma'am, then alay ko breathe gamit ba. Okay. So I'm going to place the dropper 1 centimeter above the nares to avoid contamination. Okay. 1, 2. 1, 2. Okay. Done. And instruct the client to stay on supine position for 5 minutes. Okay. Galayin ko move, ma'am, palalam pa. Okay. 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 So we're done with our second axis. Now let's move on to the third axis or the last axis, which is the frontal and the maxillary sinus. So this time is so for the frontal and maxillary sinus is we're going to tilt the head back or pillow with the head turned toward the midline of the ethmoid bone. So, and the rationale behind this is that so now let's start. Okay, so first is I'm going to asa ka direta start. Okay, so direta start, ma'am. So I'm going to move. Okay, so comfortable ka. Okay, then I'm going to assist the head of our patient with my non-dominant hand. Then I'm going to tilt the head with this side. Okay, left, right. Okay, okay, then see, already assisting the head of our patient. Then I'm going to place the I'm going to instruct the client to breathe through mouth. Okay, so alayan ko ginhawa, ma'am. Then, okay, then I'm going to place the dropper 1 centimeter. Okay, 1, 2. Okay, then other side. 1, 2. Okay, then instruct the client to remain in supine position. Okay, so align. Okay, then have the client in supine position. Okay, then next to it is I'm going to offer facial tissue to blot the secretions away. Okay, so ma'am, ito na ang facial tissue. Okay. Okay. So, before I forgot is I didn't use clean gloves since there is no excessive secretions from our patient, and the standard or the reason for we should wear clean gloves when there is an excessive secretion. So that's the reason for it. Okay. Then after administering the nasal drops, now we are ready to assess the client in comfortable position. So this is to restore the comfort of our patient. Okay. So asa kalayhan ma'am, dere or mo balik ka sa imong kanan. Okay. Okay. So after assisting the client in comfortable position, now is we're ready to discard or dispose the solid supplies, and we're going to wash our hands also. Okay. So I'm going to leave these empty nasal drops for later use for the patient demonstration on how to self-administer. Okay, then I'm going to wash my hands to reduce the transfer of microorganisms. And also, we're disposing our solid waste in a proper container to have a clean and neat environment. Okay. Okay, so we're done. Next is to observe client of onset side effects for 15 to 30 minutes. Okay. So the rationale behind this is that the drugs absorbed through mucosa can cause systemic reaction. So it's very important to observe the client. Okay. So we're going to assume that the 15 and 30 minutes have passed. So next to it is we're going to ask the client if she is able to breathe both nostrils, and also if wala na ba naglisod ang patient sa pagginhawa, and if this may be the case, then atong i-instruct ang client na muginhawa kaning both nostrils or pikas na nostrils anahon, then the other side na pod which is one at a time. So ma'am, kamusta na imong paminaw?
Okay na, nurse, di na pre ato una na tingot kay siya ni.
Okay, so
taro.
kung atong i-compare ang before and after sa atong medication administration, ma'am, so mas maayo
Mas
na rin.
maayo, nurse.
Okay. So alayan ko breathe deeply, ma'am. Okay. So wala lang kayo na feel na murag na inibara sa imong.
Wala naman, nurse.
Okay. Then alayan ko kuan sa imong nostrils, ma'am. Okay, uklod, dayon breathe deeply, ma'am. Okay,
Kaya
then
nice.
the other side, ma'am. Okay.
Kaya.
So, okay. So, the patients mentioned na wala na siya naka-feel og any, wala na siya naka-feel nga na na-block sa iyang nasal passages. So, the rationale behind this is that to determine the effectiveness of the decongestant medications. Okay. And for the next step is we're going to re-inspect the condition of the sinus or the nose of our patient. Okay. So I'm going to re-inspect it. So this time I'm going to use a pin light again. Okay, so akong i-re-inspect ang imuhong kuan, ma'am, condition sa imong sinus. So between installation sa atong nasal drop. Okay. Okay, higher naman na. Okay. Okay. Very well. So the result is there is no more secretions, and based on what the patient mentioned is na nakaginhawa na siya tarong. The comparison between before naghatag medications and after the medication. So the result is nakaginhawa na siya tarong this time. Okay. And the next step is to ask the client to review the overuse of the medications. Okay. Okay. So we're going to ask the client to review the risk of overuse and the method of medication administration. Okay. So sa atong procedure na nabuhat, ma'am, unsa ang kaning risk or the possible risk, nakabalo na ba ka, ma'am, if kana na overuse na to paggamit ang medications, especially sa nasal drops?
If supposedly naka-sinusitis na samta na noon, nurse, or magka-irritate ako inom.
Okay, ma'am. So since prescribed sa doctor, ma'am, is 2 drops ragod ang nasal paggamit sa nasal drops. So if ma-overrun nimo, ma'am, like na imbes 2 ra siya, nahimo nimong 3 or more than, it means na naa kay raise na ma-infect siya, ma'am, and magka-worse ang imong sinusitis. And also naara kaning naka-remember na ka, ma'am, sa atong mga head positions or anything?
Naka-remember yun.
Okay, very well. So the rationale behind this is that this is to ensure that the client is willing to self-administer the medication. Okay. And the next step is to have the client demonstrate self-administration. So this is to the rationale behind this is that feedback demonstrates learning. And I forgot the rationale before before this step is that ask client to review. So still the feedback will give us that the client is ready for self-administration also. So now have the client demonstrate. So ma'am, since nakuha naman nimo tanan ang mga possible na position sa atong head while nag-administer ta sa atong nasal drop, and also ang pila ka drops ra ang needed ma'am. So pwede ba nimo siya ma'am na demonstrate karon para may balan ako ma'am na ready ka to self-administer?
Sige, nurse, pero okay, hindi rin ako din. Ako na isang din,
Okay.
nurse. Expect ako lawas, nurse. Okay.
Okay, ma'am.
Can you
So,
show, nurse?
empty, this is a empty nasal drop bottle for patient demonstration. Okay.
Depende magud siya kung asa ang sakit sa akong sinus, di ba, nurse? And then, na yung mga
So,
different positions.
yes, night 3 access. So,
Example.
either lang ma'am.
Okay, example, nurse, okay. Whether asa magaling na siya, I'll have to tilt my head backward. And then, if ever katong lain nga, I'll have to use the, kanang pillow, or sa edge ba sa akong table. And then, dapat ko kung ginawa sa akong bara, mga 1 inch ba dun, 1/2 inch or 1 centimeter. Ano siya, unsay prescribed sa doctor, nurse. And then, muto siya, ako sa ilim siya 5 minutes, mahigdas ako for 5 minutes. And then, dili sa pod ko mo sikma, dili sa ko mo
So,
sikma.
several minutes.
Oo. Kay mausik niya ang tambal. And then, tapuhan, auto siya.
Okay. So, very well. Thank you for that, ma'am. So, now, our patient is ready for self-administration. Then, after that is we're ready for the recording and reporting. So, I'm going to put this one. Okay. Now we're ready for the recording and reporting. So first step is to record medication name, the concentration of the medication, the number of drops required, okay, and also which nostrils it was administered. So we administered it by the both nostrils, okay, and also the time it was administered. Okay. Then also we're going to record the client's response to our nurse's note. So as what the patient stated na before the administration of the medication is naglisod ginhawa ang patient, then na secretions also. Then after na-administer na nato is na arang-arangan na iyang paminaw. Okay? Then the overall procedure is effective sa patient. Okay. Then the last one for the recording and reporting is to report any unusual systemic reaction or effects to our nurse in charge or the physician. So it is very important to report any unusual systemic effects, since as what I've mentioned, when the drugs are absorbed by the mucosa, so it can cause systemic reaction. So it is very important to report. Okay. So that is for our administering of nasal instillation. So see you for our next return demonstration.